Hey everybody, this is Dr. Kyle with Ice Clinics bringing you your next tip for Tuesday. What I wanted to talk about today primarily consists of the upper extremity, and what I want to do is feed off of what Dr. Eric talked about a few weeks ago where he was addressing elbow health, but also within the context of the shoulder, the wrist, hand, and kind of the upper extremity as a unit. And the main condition I wanted to use to highlight that today is a syndrome they call Dequervine's Tenosynovitis. And that's a very fancy term for essentially your tendon sheath right here in your wrist getting inflamed and irritated. A lot of that, as you can see in my hand here, will come when we make this motion with our thumb, but where it's not through a full range of motion. So we're not bringing it all the way forward, we're not bringing it all the way back. It's kind of sitting in this happy medium. And what will happen is these tendons get irritated and inflamed down into the wrist here. And it can actually be pretty debilitating. I've treated a few patients that have trouble just with any fine dexterous movements with their hands or their thumbs, and really affects their overall quality of life. So for this particular condition, it's important to remember that a lot of the tendonitis, tenosynovitis, will manifest where the over repetitive stress is occurring, but it's also related to other body parts maybe not cutting their weight, like an elbow or a shoulder that's dysfunctional or tight or imbalanced. And what it's doing is it's manifesting all the stress in this particular area. So anyone that's watching this that's suffering from Dequervine's tenosynovitis, important to remember what is the rest of your extremity doing, and also remembering what's going on in your spine as well. Because just like with this chart, you can easily see from the neck, this is where all of our nerve roots come off of and feed down into the arm, all the way down into our fingers. So someone that has some altered neck health, from whatever particular reason, this could also be playing into why this has manifested here. So one real easy tip, you guys have seen me do this over the course of time with my trusted rubber band here. My favorite exercise for hand health is just simply expanding, doing this, multiple repetitions. And you can see, probably from this angle, you can see me working these exact tendons with this particular movement. So a really good way to kind of help with the durability of the hand. But for anybody watching this and this is not doing your trick, try and remember what I was talking about as far as the mechanics in the arm playing into the neck. If there's any way that we can help you at Ice Clinics, don't hesitate to reach out and give us a holler. Again, my name is Dr. Kyle with Ice Clinics, and thanks for watching.